PRI skill number 3 is stabilizing your body weight on your left leg and being able to breathe using the appropriate musculature. And this is where the meat and potatoes of a PRI program is. So remember, skill number 1 is getting off your right foot. Skill number 1.5 is overcoming any resistance that is preventing you from getting off your right foot or getting into your left hip, which is skill number 2. Skill number 2 is getting into your left hip, which we call left AFIR, which is really just the way that your pelvis, the left side of the pelvis, internally rotates on the left leg as the left leg internally rotates on the left pelvis. So we end up with a pelvis that's oriented to the left and a femur, an upper leg, that is internally rotating on the pelvis. So they're both rotating internally on each other with a left foot that is at mid stance of gait. So that means the arch is coming down. Your left knee is unlocked. The left side of the pelvis has rotated to the left and pulled back into a posterior tilt, it has to go, you're pulling it posteriorly via the hamstring. And then at that mid-stance phase of gait, that's where you have to be able to stabilize that pelvis without it falling forward again, which results in arching your back, without turning on compensatory muscle patterns, without using your lower back or your hip flexors or your calf to try to stabilize you, and without falling back to the right prematurely. So you gotta get to the left, then you have to stabilize there for long enough period of time that you don't prematurely fall back to the right side. And that's where people really struggle. It's nothing that you would notice unless you really have an eye that's trained for it. But it's really hard. And a lot of people cannot do it. And that's why they can't stay neutral. Their pain just kind of comes and goes. Sometimes they have good days, sometimes bad days. Something is not letting them stabilize on that left leg. So what do you need to stabilize on that left leg? Well, first, in terms of our pelvis, our rib cage, and our neck, to stabilize on that left side, it means you actually have to be on that left side. So you have to get that pelvis oriented to the left. You have to get the spine to also orient to the left, and you need that ZOA. So you need the left internal obliques, which also support the pelvis. The ZOA, well then you also need to be able to expand the left side posterior rib cage backwards at the same time. So the left pelvis has to be oriented left and pulled back on the left. The left spine, the spine rib cage have to be oriented to the left. The left ribs have to be able to come down in the front or go to the side in the frontal plane and down in the sagittal plane, which gives you that left ZOA. And your neck also has to be able to orient to the left. Some people have a right TMCC pattern that does not, overactive neck muscles basically, that does not allow their neck to fully rotate. But the only way it's going to fully rotate is if you can get everything down below lined up also. So everything has to go to the left. And then there will be counter rotation back to the right side, but that will be skill number, skill number 4. So right now, you're thinking about how do I hold myself in left AFIR, in left mid stance, with a pronated foot on a unlocked left knee with a posterior rib cage that's back, with your left arm swinging forward. How do you stabilize in that position? That's most of what the PRI exercises are getting you to do. You're using your left hamstring, you're using your left inner thigh, your left adductor. The big one and the most unappreciated one, and probably the hardest to access, to really feel for a variety of reasons, is the left anterior glute medius, which, here's your left leg, it kind of covers right here. So it helps pull the femur and the pelvis into a better relationship, and then it's also responsible for internal rotation of the left leg. So that anterior glute medius is a huge muscle, and it's hard for a lot of people to access, to facilitate, for a variety of reasons. I'm not going to get into every single reason, but I have found that the biggest sticking point in most programs where most people struggle to stabilize themselves on their left leg as their right leg is moving through the air is that anterior glute medius. So that is skill number 3, stabilizing your pelvis while the left side of the pelvis while in left stance, left AFIR, with the appropriate rib cage position, maintaining the left ZOA.